Professionally, I work in the field of mental and behavioral health with schools supporting students and families, but I also have a child myself, a daughter, who has lived with anxiety and depression and experienced thoughts of suicide. If a parent was worried about being judged and coming forward to help connect their child to mental health supports, I would say your role is so incredibly vital and important. And just like if your child came to you with a broken arm, you would take them to the doctor. If your child comes to you and says, I'm struggling with depression, they may need to go to the doctor too. In terms of signs that there might be a mental health issue going on in a teenager, I would say to parents to watch for changes in sleeping habits, maybe even eating habits. That can be a red flag. Withdrawing, isolation is a huge one that we see in kids who might be dealing with depression. And then just general behavior changes. So maybe loss of interest in an activity that they once loved. For elementary kids, if we're, let's say, grades K through 5th, some of the signs that we might first see are more somatic or physical complaints, so complaining of a stomach ache or a headache, wanting to go to the nurse. That might be an underlying sign that there is some anxiety going on, or it can even be depression. If you're a parent and you have a child who is experiencing thoughts of suicide or is in the ideational phase of suicide, as we sometimes call it, one of the best things we can do to help them is to give them the tools to sit with that thought and understand that a thought does not have to become an action, and we can sit with some really hard feelings, and they might be scary, but they don't have to become that action if we learn how to cope with that thought and get through it. As a parent, I would also say we want to make sure that our homes are safe. So we want to make sure we don't have weapons that a child can access if they are having those severe thoughts in that moment, that prescription pills are locked up and in a safe place, and that we're really monitoring them and watching them closely to make sure that they're safe.